And more now on one of our top stories. More young people have been involved in drug abuse and sexual offences over the past 5 years.
And for a closer look on the report on youth delinquency, we're joined now by Professor Paulin Straughan from the Singapore Management University. Professor Straughan, what can be done to tackle the upward trend that we're seeing in sex-related cases among youth offenders?
Thank you very much for having me this evening. I think certainly in this regards, education is a very powerful tool. We must set boundaries very clearly so that poor behavior cannot be negotiated. What constitutes harassment and what seeking consent means and what respect for each other entails. I think these are important boundaries that must be drawn very clearly. And of course, now we have the various recording devices available. Here again, we have to educate that it is a crime even if the perpetrator records for his own private enjoyment, right? So I think with regards to everything else, right, I think we have to understand that, with each generation stepping up, we need to reinforce what the boundaries are and what cannot be crossed.
Now, Professor, you've mentioned that, education is a powerful tool. But when it comes to drug abuse, there's also been a rise despite years of anti-drug campaigning.
Yeah, so, new norms are set every day, right? So with regards to drugs, there are always temptations lurking and new party drugs that entice. So the problem for our vulnerable youths really is the reframing. They look around and just because these drugs are available, just because others are using it, we have to then educate them. Just because you can doesn't mean that you should, and it doesn't mean that it's legal.
So the help is certainly there, Professor Straughan, but are the existing initiatives sufficiently equipped even to address the most common mental health conditions among young offenders?
This is a part of the report that I find very difficult. I mean, let's get this straight up front. Mental illness is not poor behavior, right? So when we discuss youth offences and when the law is broken, we must not immediately associate the irrational to mental health issues. This is how negative social stigma on mental illness is entrenched. I mean, for example, many suffer from ADHD in the community, but they are certainly not more likely to commit offences compared to those who are disease-free. So I think we have to be very, very careful here when we make these very casual, links. The truth of the matter is, whenever there is a violent crime, it spooks us completely, right? And we cannot make sense of the situation. And then immediately we say, oh my goodness, this person must be mad. And so we succumb to attributing the act to mental illness. In most cases, the offenses are deliberate acts. So we should not attribute poor behavior to mental illness.
And also, the stats show that there are over 4 times more male youth offenders than female. Does it have to do with the biological differences?
This is a persistent trend, right? So I've been trying to follow the literature on this. Certainly, we're trying to make sense of why there is a difference. But if you look at the predispositions, right, we see that a history of family violence, for example, is a very important contributing factor, right, to youth offences. So I think there is evidence to suggest that there's a gendered difference, right, in reactions to these triggers. Females, for example, tend to self-harm and they tend to commit less violent crimes, whereas males tend to be overrepresented in the categories of violent offenses, and that's why they stand out, right? And the literature also suggests that, the biological makeup, right, the rationale could be one explanatory proposition is that males tend to mature slower they mature later than females. So they may lack that maturity to develop effective coping mechanisms when there are triggers in their environment. And of course, there is then peer influence because there are more male gangs, there are more male, violent subcultures. So therefore, by association, poor behavior is learned in that way as well.
Professor Straughan, in identifying some of that learned behaviour and perhaps where these youth are falling off, are there blind spots perhaps that society is missing, something that we need to sort of look more closely at in matters concerning youth offenders?
Well, if I reflect back on the NCPRR report, right, I see many innovative programs advance, and it's actually very progressive. And each scenario, each age group, there is a specific, unique, program that attends to the environmental and social circumstances, that is that surrounds that risk group, right? That high risk group. I think for us, it is perhaps most important for us then to pause and assess the impact of these interventions. Because we have programs, we have so many programs available, sometimes, that causes us to take our eyes off the problem spots because, we feel that, all these programs are already in place. So surely, it can attend to the concerns. What we sometimes forget to do is assess the effectiveness and impact of these interventions so that we don't go away with a false confidence that we've got it covered, right? We are living in difficult times. We're living in a very prolonged pandemic, and the effects of this prolonged pandemic is still emerging. So I would pay very careful attention to the stresses and challenges that are faced by our youths while navigating through the new norm, that we now have to embrace.
It's been very good talking to you. Thanks so much for your time. Sociology
Thank
Professor
you so much.
Paulin Straughan from Singapore Management University.